My name is Janan Jensen, and I'm the Executive Director of the Health and Environment Alliance, and it's my pleasure to be the moderator today. HEAL has been working as an organization since our beginning almost 20 years ago to raise awareness and promote quicker action to reduce our daily exposures to EDCs and the associated negative health impacts, especially for those most vulnerable. So today's event is a very exciting moment to hear more about the action from the health community and in particular mutuals to prevent disease and ill health, and the policy opportunities to advance protection from EDCs that are on the horizon. Before we get started, just a few housekeeping rules. First of all, please keep your microphone muted and videos turned off. You can also post your questions alongside with your name and organization in the question and answer box. We'll note down the questions and get back to you over email as soon as possible. Lastly, this webinar will be recorded and we will make available the slide sets after the event and shared with you along with other resources with the email that you signed up with. And my colleague Yvonne Lennon, who is supporting our communications and logistics for this event, will be putting in the chat the hashtag that you may want to use as we begin this webinar. So I would like to ask Luc Caubo, who is the president of the International Association of Mutual Benefit Societies, AIM, to turn on his video. And I would like to give him the floor to give us a welcome and an introduction. And it's really nice to have you with us here this morning. The floor is yours.
Thank you very much, Janan, for this introduction. Ladies and gentlemen, dear colleagues, it's a pleasure for me to welcome you to this webinar. And I would like to start by thanking the co-organizers of this event. That's HEAL, of which AIM is. Thank you again, Janan, Yvonne, and Natasha. That's the Belgian Mutualités Libres, which is one of our members. Thank you very much, Christian. And of course, our speakers today for participating to this debate, Maria Nera from WHO, Zekia Ulmer, and Erich Koch. Growing evidence highlights the links between the exposure to EDCs and serious health conditions, such as adult and childhood obesity, gestational diabetes, reduced birth weight, prostate and breast cancer, to cite but a few. It is estimated that the health costs arising from EDC exposure amount to at least 160 billion euros per year in Europe alone. Therefore, limiting exposure to EDCs represents a double win. It would bring considerable public health gains, but it is also an economic opportunity. As some of you might know, AIM stands for the Association Internationale de la Mutualité. We are an organization gathering healthcare mutuals and statutory healthcare funds, that is, the organizations in charge of reimbursing healthcare costs. Some of you might then wonder, what can be the role of healthcare payers beyond covering healthcare costs? What can their role be regarding the topic that brings us together today? Well, this event will precisely allow us to answer that question. You will see that mutuals and health insurance funds play different roles which go well beyond offering healthcare coverage. They have a clear role to play when it comes to the prevention of exposure to EDCs. I give some examples. They provide for coaching and health education, taking responsibility for informing on the risk of exposure to EDCs and how to limit that exposure. They support general practitioners in order to facilitate and encourage preventive and awareness-raising actions. Through their systems, mutuals and health insurance funds have access to a large amount of data and information, which can be used to develop and evaluate implemented measures. Mutuals also promote research. And of course, mutuals are important actors on the political dialogue on national and European level. They exert political leverage on governments to take action and to protect population health, including when it comes to EDCs. Today's event will show how mutuals can be a valuable partner and contribute to creating awareness on EDCs. You will hear later from 3 of our members. They will provide concrete examples of some of the roles that mutuals can and do endorse. You will also learn about current European and international initiatives on EDC, which provide the broader context in which our event is organized. And finally, we hope that this event will inspire you to take action at your level to limit exposure to EDCs, because that is a responsibility for all, as the title of our declaration highlights. And that declaration is published today on the occasion of our event. Our director, Sibylle Reichert, will provide you with all the details about it later. I thank you all for participating to our debates, and I wish you a very fruitful exchange.
Thank you very much, Luc, for that good, excellent overview and framing. And I really liked talking about how it's a double win, not only for public health and our health, but for the economy, and how mutuals are doing so much to and can be a valuable resource. So thank you. And I look forward to hearing your comments throughout the meeting. And I would like to now introduced our first speaker, and this is Dr. Maria Nera. As for those of you who do not know Dr. Maria Nera, she is the director of the Department of Public Health, Environment, and Social Determinants of the World Health Organization since 2005. She's a pediatrician, and she's also specialized in endocrinology. And at HEO, we have been working with Maria for probably over almost 2 decades on climate change, on air quality. And it's really exciting today to welcome you, Maria, to talk to us about what WHO is doing on endocrine disrupting chemicals. And I look forward to our conversation. So the floor is yours, and great to see you. Oh, your microphone is muted. Sorry, there you go.
Sure.
You can unmute that. Perfect.
Thank you
yes.
very much. Good morning, Janon. And of course, you cannot start your working day without hearing at least once your microphone is mute. This is the center day of the year. So welcome, everybody. And thank you very much for this invitation. Thank you, HEAL, and thank you, Mutuals. I think it's a fantastic opportunity, and I thank you very much for this opportunity for this initiative to raise awareness. Maybe I will start by trying to put things a little bit into context. We are in the middle of a terrible situation from a health point of view, from an economic point of view, from a societal point of view. And I think all of us working on public health, we have an additional responsibility now, in addition to what we have been doing on raising awareness about the different public health issues. I think now we have the double responsibility of helping the society to better construct the next steps to recover from this COVID-19 and the crisis around that. And this fits very well in our agenda, because the only way to recover from this terrible crisis will be to have a more sustainable way of consuming, living, commuting, working, and the way we produce our food and everything. So this goes very much in line with what we are trying to achieve here. If we want to address this particular public health issue related to endocrine disrupting chemicals, we need to promote as well a more sustainable way of producing and consuming, and understanding how much we need to be sustainable in our life, in our way of promoting our economy as well, if we want to protect our health. And I think it's interesting to put endocrine disrupting chemicals into this context, because we can then align forces with all of those who are arguing and promoting and trying to influence this type of more sustainable, less aggressive, less pollutant, and different way of living. As you know, WHO, probably you know very well, WHO did a few months ago already a manifesto for a healthy and green recovery. And we have 6 prescriptions and 86 actionables. I will not go into detail into that at all, but just to remind all of you, I'm sure you are aware of that already, that the first prescription we are promoting for a healthy and green recovery, for as well recovering our economy, which is so fundamental as well to be able to provide a good health services needed, a more preventive approach. And this more preventive approach starts with stopping our war with nature, stopping to destroy whatever we have around us and from the ecosystems, because this is the source of our health, or of our life, and then it will procure us the air we need to breathe, the water we need to drink, and the food we need to eat. And this is where we, with this agenda of the EDCs. WHO has been working on EDCs, maybe not with the level of intensity we would like to, because it says one of those difficult topics is quite emerging, is definitely a difficult one because of the research needed and all of that. But there are things that we know, and we need to try to make sure that we share that knowledge. Obviously, EDCs, or the endocrine disrupting chemicals, the problem with them is that we are dealing with an issue that those chemicals are ubiquitous. So they are present in our daily life. And most of our common products, the ones that we are using every day, including cosmetics or including plastics, things that we use every day, might contain endocrine disrupting chemicals. And then, therefore, the exposure of the humans to food or to water is quite, I would say, common. In addition to that, and to add more difficulties, that many of those chemicals in use, those that we are using very, very frequently, they have never been tested for health effects. So this will complicate even more the topic and the difficulty to share this knowledge and to raise awareness. We know as well which groups are the most affected one, the most vulnerable. And clearly there will be the fetuses, the children and adolescents, because of this neurodevelopment and the physical development as well. And therefore, we need to, at least we have already a very important target group audience, can be parents, and then addressing those interventions to protect those who are more vulnerable. Clearly, I think we all agree that more research is needed, but this is not an excuse for not having action. More research is needed on which chemicals are the ones that they will have this disrupting endocrine disruption. We need more research about the ways of exposure. We know about this synergistic approach. We know that we need to know more about what are the sources of exposure and what are the combination of these exposures that might represent a risk for public health. But then we need to select, and having this panorama of the needs for research, the knowledge that we need to get a little bit more deep on it, knowing that we, at the moment, there are around 800 products that we know that they have this function, this endocrine disrupting function. How can we then keep with our agenda on identifying what are the chemicals that might have this harming health effect? And that will be a huge one. Therefore, we need to be very strategic on the preventative measures. How do we promote those preventative measures? We need to share the message with the communities. There is some awareness that is now growing about the issue of endocrine disrupting chemicals, EDCs, but this is still very people, the one that knows about. There is some awareness growing in terms of, for instance, people talk about certain cosmetics and they don't want that they contain parabens. This has been a fantastic campaign that I'm sure that your organizations have contributed to that, to raise awareness about the importance of which of the common chemical products that we use every day can be harmful for your health. And the knowledge is growing, but it still is very, very limited. So we need to focus on those preventive actions by proposing something that is probably common sense, and nobody can argue saying, oh, you need more research in order to make this recommendation. One of the most relevant and I think public health basic recommendation, and for which we have enough knowledge, is we can avoid unnecessary or abuse of the chemicals we have in our daily life. We can, of course, we need to reduce or even eliminate chemical exposure. But if we could stop the use of unnecessary chemicals, the use at home, for instance, these campaigns telling the families, telling the parents that they don't need to have, when you open in a house, the place where they have the cleaning products, starting by probably all of us, that the number of chemicals in our houses are incredible. So raising awareness about the need that we don't need plastic bags. We don't need to every day be surrounded by food products that are put it in not only one plastic bag, but three maybe. You know, sometimes when you finish your lunch outside, now particularly that is delivery at home, you realize that to eat 6 pieces of sushi, sorry to focus on a Japanese product, but it could be any product that you take at home on delivery. You will, at the end of eating 6 pieces of rice and tuna, you have 6 or 7 plastic recipients. I mean, the plastic bag, you have all that it goes together, and it's really terrible. So we need to, now that with these lockdowns and the fact that the restaurants are closed, the use of plastic might become again increasing. We need to be very much attentive to that. And as I say, join this campaign to others, promoting a more sustainable consumption as well, and reducing the use of plastic, and join those movements that are promoting the reduction of the use of plastic, or the completely ban. Then, of course, we need to raise awareness with the families about the risks that these represent and how they can do better at home and reducing unnecessary use of chemicals. Of course, WHO is supporting any initiative that is going around this more science around the state of the art on endocrine disruptors. We support, of course, the identification and management of endocrine disrupting chemicals, and we have the WHO assessment and management programs, including for those chemicals in the air, in water and food, as well as the program on public health pesticides. And I'm sure that you are all very familiar with the sound management of chemicals, which, as you know, WHO has approved an important resolution about sound management of chemicals in the World Health Assembly. I think it was resolution 69.4 about how to strengthen the role of the health sector into the sound management of chemicals. And then there is a roadmap, and this is where again I call your support on aligning on this roadmap for the chemicals, and bringing the role of the health sector, the advocacy that can be done by the health sector, the engagement and the knowledge by the health professionals that sometimes they are not well equipped to provide advice to their patients about the risk that might represent exposure to chemicals, even at the household level. So I think we have a big task in front of us, a big cause as well, and a big mission, because if we can keep doing work on raising awareness about the EDCs, promoting more research and stimulating those preventative measures for which we know we have already a very solid base for promoting it, it will be great. I'm sure you are aware that WHO did the first assessment of the EDCs in 2002. That was a report that caused a lot of interest and raised a lot of awareness, but that was in 2002. Then we did a revision together with UNEP in 2012, and I suppose 2022 could be a year for yet another big study about the state of art on endocrine disruptive chemicals. But for that, of course, your precious help on disseminating, raising awareness, and creating this movement for a more healthy and sustainable way of consuming, and the way we use the chemicals, the way we explain people that this sustainable development is not just a slogan, it's something that will contribute to protect our health, to make us less vulnerable for potential future crises, and at the same time will be a perfect way to recover our economy, because they will generate different type of jobs, but definitely more sustainable, and an increase in the number of those green jobs, which is very much needed at the moment to recover our economy. Once again, thank you very much for your support, your help, and for your contribution, and for pushing for these initiatives. I know that your action with the European Commission and others and the policymakers is very important, so we applaud for that, and we thank you once again. Over to you, Jenon. Thank you.
Thank you, Maria. Thank you again for coming with us. And I think just I was very interested to, first of all, I think a very useful suggestion to frame EDCs within the healthy and green recovery, because that is a wider one that many of us are working on. Very useful. And also your focus on preventive actions and measures. And I was delighted to hear that perhaps there is a 2021 state of the EDCs from WHO. I think that's with everything we're going to hear from the next speaker about the opportunities. I think this would be a really strategic investment for WHO, and we would love to support it in any way we can. So thank you very much. And if we have questions for Maria, you're welcome to put them in the chat box. We don't have time to answer them, but we can perhaps liaise with her and get back to you should you have any. And thank you for your time during this busy moment, especially for WHO, and for your dedication, Maria.
Pleasure. Thank you once again.
Okay, great.
Thanks.
So now I'm going to move on to our second speaker, and this is Natasha Sinchati, who is the lead of the Health and Chemicals program at HEAL. Many of you may know her from all the work that she is doing on the around EU and national advocacy on chemicals, pesticides, and EDCs. And she's also representing HEAL in the EU institutions for the Parliament, the Commission, and one other exciting thing I wanted to share about Natasha is that you may know her as well because she is very much an expert and well set off from journalists and other radio, TV to highlight what the opportunities are around chemicals and our health. So today she's going to give us a short presentation on EU action on EDCs. So I will give you the floor and we can see your screen, Natasha. Thanks for being with us.
Very good. Thank you, Jenon, and good morning to everybody. Thank you for being here with us today. Thank you, Dr. Nera, for your introduction. I think this was a perfect opening to what I'm going to talk about because I've been asked to share with you some perspectives on opportunities for action at the European level on endocrine disruptors. And in fact, I must say this is an exciting moment to be talking about that because we do have a frame for those actions. And some of you who have worked for a long time on EDCs know that campaigners, civil society advocates have been asking for a frame for action on EDCs for a long time. And that frame came in October 2020 through the European Chemical Strategy for Sustainability, which is part of the European Green Deal, which is broader than just dealing with EDCs, but obviously includes action on EDCs. And I think from a health perspective, this is a very interesting initiative because it exactly brings this shift we have been asking for and looking forward to in terms of chemicals management by putting prevention first. And this prevention first stems from the vision that is enacted in this strategy, which is a toxic-free environment vision with a toxic-free hierarchy, which essentially revolves around two pillars. And the pillars are about producing and using chemicals, first of all, in a way that avoids harm, and second of all, in a way that promotes a safe and sustainable by design approach to chemicals. So obviously, what I'm mentioning here is broader than EDCs, but I think it is very relevant and very important when we talk about taking action and when we talk about minimizing exposure and overall protecting people in a better way. So I think it's important to mention before I get into the nitty-gritty of specific initiatives that relate to EDCs in the strategy. So bear with me, as always, with EDCs, it gets technical, but I will try to help you make sense of it. I think in terms of wins in the chemical strategy for endocrine disruptors, what we're very much happy about are initiatives that revolve around two pillars. The first pillar is the question of improved identification of those substances. And the second pillar is a pillar around improved regulation of those substances. So first thing first, of course, there's a key question around endocrine disruptors for those of you who have followed the debates. And I saw there was a question in the chat about where can I find a list of EDCs? Well, the question of how you identify those substances is very much at the heart of the policy and scientific debate, and has been one for very long years at the European levels. Now, I think the measure we're most excited about and most engaged in at the moment in terms of this pillar of action is a European commitment to introduce harmonized identification criteria for those substances across sectors and across legislations. At the moment, we only have scientific tools to identify EDCs under the pesticides and biocides legislations, and that is meant to change with the introduction of categories for EDCs under the classification, labeling, and packaging law in Europe, which allows us, for instance, to identify carcinogens, mutagens, reprotoxicants. So that is a very important process that is starting right now. We're right in the middle of discussion on this, and will really provide a basis for anything else that will be done around endocrine disruptors. Two other important things to mention in terms of identification. Of course, to identify a substance of concern, you need to have the right information provided by industry players. And at the moment, in EU laws, you don't have the right provisions to do so. So the strategy has committed and has in fact started the work to update the information that industry needs to provide when registering the chemicals. That is a huge step forward, that is incredibly technical, but without this update, we will not be able to identify the substances that matter or that we're concerned about. The third thing, which is relevant for people following maybe the industrial chemicals legislation's reach, is that there is a commitment under the European strategy to create a specific categories of substances of very high concerns for EDCs under the REACH regulation. Why it matters is that at the moment under REACH, for instance, you can identify substances that you might have known about, you might have heard about, such as bisphenol A or DHP, phthalates, but they do not have a specific category. And you need to prove that those substances are of equivalent level of concerns as other hazards, such as carcinogens, mutagens, reprotoxicants. That makes the process very lengthy and very difficult. And it's very, very good that the European Commission has committed to fix that. Now, based on this improved identification system that is starting being unfolded right now, the EU has committed to improve the regulation of EDCs. And I think the flagship promise in that regard is the promise to ban EDCs in consumer products, so toys, food packaging, cosmetics. And of course, doing that will be lengthy, but essentially the approach is twofold. Over the long term, the idea is to have the same approach as we have for carcinogens, mutagens, reprotoxicants. In the EU, you have an approach that's called the generic approach for CMRs, which means that in certain legislation, such as pesticides or cosmetics, they are by default not allowed. And the EU wants to extend this approach to other hazards, such as EDCs. As you can imagine, this will not happen overnight. So the work will take probably a couple of years before it can really be enacted. And in the meantime, while we're waiting for this approach to be enacted, the idea is to launch a series of restrictions under the REACH regulation that will cover substances of concern, including EDCs. Of course, what I'm mentioning here, I know is technical and probably new for some of you, but this is just important to let you know that there are several initiatives being taken both at the identification and regulation levels that were involved in them as well. We're involved in high-level advocacy with governments, with EU institutions. We're also involved very much in the nitty-gritty of the discussions in some scientific committees at the European Chemical Agency or with regulatory agencies across Europe. And that our job is essentially in the coming years, I mean, starting now, but it will unfold over the next months and the next years, is to simplify those processes and to bring them out to our members, the mutuals, the health groups, the council leagues, but also to the public, so that at key juncture of these decisions for progress on those processes, we can really convince legislators to take the right decisions. And that brings me to the point that I would really like you to take away when thinking about the chemical strategy and EDCs is that as here we see this chemical strategy as really an enabler for increased protection against endocrine disruptors. As you've heard and as you know, the issue we have at the moment is that we have suspicion of endocrine activity, endocrine-related adverse effects for loads of substances. I'm mentioning here the alternative list of potential EDCs of the TEDx list, about 1,500 substances listed as potential EDCs. I'm also mentioning here the interesting work being done at the moment by the French regulatory agency ANSES, which is doing a prioritization exercise of substances that they will assess. They started from a list of about 900 substances of interest due to endocrine activity. And they're trying to reduce this list to really decide, okay, from what we know of potential endocrine disrupting properties, how many really are endocrine disruptors? And that is the gap that we see, that we have lots of suspicions, but if you look at the number of substances that are identified per law at EU level, you only have about between 18 and 20 because the number is slightly increasing. I'm actually putting here the reference of a very good resource, an endocrine disruptor list put together by a number of member states, which allows you to see which substances have been identified at European level for the endocrine disrupting properties, and also which ones are being assessed right now. So the point that I want to make here is that this chemical strategy can really be an enabler if it helps bridging this gap between suspicion and certainty, because to put forward regulation, to increase protection, we need more certainty about whether substances are known, presumed, or only suspect EDCs. So I will leave it at that. Those slides will be shared, and you will find some resources, including general papers on endocrine disruptors, but also more technical comments for those who are interested. Thank you very much.
Thank you very much, Natasha, for that excellent and very concise frame on EDCs within the EU and some key takeaway messages. I would like to now move us on to the next part of our webinar, which is the panel discussion called Mutuals in Action. And here, I'm really pleased to be able to introduce and ask our three panelist speakers to turn on their video so I can introduce you all as we go forward. So we have Christian Hormans from the Mutualités Libres. who works as an international affairs manager at the National Federation of Independent Health Insurance Funds, which is the third biggest group of health insurers funds in Belgium with over 2.1 million members. Within his organization, Christian presides a task force working on the topic of environment and health. And then within AIM, Christian also participates in the European discussions on cross-border healthcare, free trade agreements, digitalization of healthcare, and access to medicine. So great to have you with us here today, Christian. Our second panelist is Zekia Ulmer, who is from the Fédération Nationale de la Mutualité Française in France. And Zekia works as a prevention and health promotion officer for the French Mutualité National Federation, which unites the majority of all the health mutuals in France, which insure more than 35 million people and defend their collective interests. These not-for-profit entities are the leading health expenditure financer after the Social Security, and they play a major role in access to care for their 2,800 care and support services. Zekia also participates in the AIM Prevention Working Group, and she will be the French Mutuality spokesperson for this intervention on EDCs. So it's very good to have you as well with us from France. Zekia, welcome. And our third speaker is Eric Hook, who is from the German Social Insurance Organization for Agriculture, Forestry, and Horticulture. It's SVLFG, and I took the liberty not to pronounce it in German, so please forgive me for that. He works as a responsible for international relations there, and he's also the Secretary General of the European Network of Agriculture Social Protection Systems. And within AIM, Eric actively participates in the AIM working group on health promotion, disease prevention, and environmental health. And he's been involved in drafting the declaration from AIM that will be presented at the end of this call. So I really welcome to you, Eric. It's great to have you with us. So I would like to begin to give the floor to Christian to present some of the best practice from Belgium and his mutual. So the floor is yours, Christian, and I will turn off my video and turn on again later.
Thanks a lot, Jenna, for the kind introduction. I'm very happy to be part of the webinar today and to be able to share what we at Mutualités Libres have done on EDCs the past year. And it's also an invitation to all colleagues, mutualist colleagues, to also step in and work around the EDCs. Next slide, please. Next slide, please, Yvonne. Thank you. It's important to know that in Belgium, there has really been, and there still is, a momentum in the sense that in 2018, the Senate has published a really big report on EDCs with over 70 recommendations. 2019, the Green Deal was launched. And in the same year, Belgium, different governments in Belgium decided that a national action plan on EDC was needed. So at that moment, as a mutual, we also thought this is also a moment for us to have our voice heard and to step in. And that's why we decided to develop a position paper with, on one hand, analysis of literature, science, policy measures that had already been taken in Belgium and outside Belgium. And on the other hand, also some recommendations for the different governments in Belgium. Next slide, please. I will not go into detail, but let's say that our recommendations are in 4 big blocks. The first one is, of course, raise awareness and inform. It has already been said by several persons. It's definitely a big urgency in Belgium. Develop a policy based on the precautionary principle. Even if you don't have all the scientific evidence, you can take measures to protect public health, and the legal framework for that is necessary. Stimulate innovation and research. As is already said several times, more research is needed in the field of EDCs. And fourthly, Belgium can play a pioneering role in Europe, especially when they will have this national action plan. And as Belgium will be taking over EU presidency in 2024. Next slide, please. So apart from the position paper, we also thought it was important to know what the Belgians think and know about EDC. So we developed a survey, we organized a survey, and 1,000 persons participated in this. And the results were very interesting. Just to give you one figure, almost half of Belgians never heard of EDCs, which can only be a stimulation to work on that. So all the figures and the results of the survey you can read in our position paper. Next slide, please. Together with HEAL, we thought it was also very important not only to develop recommendations, but also to inform our members on the danger of EDC and how to reduce the exposures on EDC at home. So for this, we developed an infographic with 10 concrete tips for people. How can I reduce EDCs at home? Like, for example, don't heat up food in Tupperware, in the microwave. So some easy things to do to change in daily behavior. So I've been working with that towards our members. And the last action we've been doing is a conference that we organized at the end of last year together with HEAL. Over 400 participants participated. So it was a nice success. And since then, we've been contacting politicians and other stakeholders to exchange on views on EDCs. So all the materials exist in English, French, and Dutch, and you can find them on our website. Thank you.
Thank you, Christian, for that short but sweet presentation. Very exciting to hear more about the survey, the infographic, and the conference, and the work you're doing in your mutual. One quick follow-up question is, how are you using or sharing this information, the infographics, to raise awareness with your actual members of your mutual?
Well, for us, it was important to have concrete materials for our mutuals to communicate towards our members. So it has been going around in newsletters, on the websites, because it was very interesting also to hear from our members or from the people who participated to the survey that they expect clear information with a clear message, backed by science. So we try to formulate those key messages in that way. And we also think that it's important not necessarily to scare people, but like to inform them about how they can avoid exposure. Because it's easy to start a scary story about EDCs and about all the objects that surround us in daily life. So we try not to do that, but more focus on what can you do.
Great, thanks. No, I think a very, very useful information that is from a trusted authority, evidence-based, and in several languages. So thanks for sharing that. I'm going to move us on to our second panelist. And I'd like to ask Zeike Ulmer to turn on her video and ask Yvonne to start sharing the presentation. And welcome, good to see you. And the floor is yours. Just tell us what you're doing in France. Yes, great.
Well, hello to all, and thank you for inviting me to participate to this webinar. I will, with this intervention, give you a quick overview of the French Mutuality involvement and commitment on EDCs. So the French Mutuality, can you, oh yeah, you can go to the first slide. Yes, thank you. So the French Mutuality commitment towards environmental health promotion sits back to its 2009 Congress. Its commitment reflects since then in its participation as an active member of the second, the third, and the fourth soon to be published Health Environment National Plan, for which it contributed to the public consultation 2020 as a public health actor and a social movement. So the entire mutualist movement contributed and sent its proposal and expectations to the Federation, which then carried them forward. So the French Mutuality, in collaboration with the French Mayor Association, also published December 2020 its annual health and social barometer. So this barometer highlights the health problems and encountered by the French population and the solutions that can be implemented to address them. So what's interesting here is that in addition to the healthcare access and the social action, it addresses for the first time the health environment determinant, which aims to raise awareness amongst all publics and private actors, highlighting the French population interrogations on environmental health and promote collaboration between mutuals and municipalities on the subject in order to meet health needs in the different France regions. The French Mutuality Regional Unions Prevention and Health Promotion Network took up the subject of environmental health in 2012, answering the mutual requests, which included this theme as a cross-cutting issue in their strategic prevention guidelines. And since 2016, it evolved as a major theme. Next slide, please. Thank you. So just a couple of words about this Regional Union Prevention and Health Promotion Network. So you have to know that the French Mutuality Prevention Strategy is implemented and relayed by its national network composed of 17 regional unions, which are antennas all over the territory, in which 180 health professionals coming from different fields develop prevention and health promotion interventions for mutual members. So to give you a bit of numbers, in 2020, 428 interventions were carried out on EDCs, some of which were adapted in relation, obviously, to the context of COVID. And the general objective of these interventions is to raise awareness on exposure to pollutants in our daily lives, to identify EDCs when it's possible, and to find healthier alternative solutions for the population. So half of these interventions targeted the general public, and the other half at future and young parents and professionals in the prenatal and early childhood sectors. Most of these interventions are deployed in the form of workshops, video conferences, information and exchange groups, and mostly cover air quality, food, cosmetics, in which endocrine disruptors chemicals can be found. So I know it's short. I hope this quick overview gives you some insight on the French mutuality context and what we do on this subject.
Thank you very much. Excellent presentation. I was quite impressed by the 429 actions in 2020 on EDCs. And I was like, is there a place where we can look at those? Even if it's in French, it would be so inspiring to read more about those. And perhaps that's on your website. We could look there.
More on the different regional unions website.
Okay.
But I can certainly give you an overview of all what we have and send it to you.
Great, great. Okay, well, I would like to perhaps move us to the third panelist, and then if we have time before we can come back with some follow-up questions. And again, if you have questions for Zekia or Christian, please put them in the chat box, and we'll also make their presentations available. So now I'd like to go to our third panelist, Eric Cook. So I'd like to give you the floor to talk about what is happening in Germany. So we're traveling across Europe here. It's good to have you with us.
Thanks a lot for introducing me. I would like to talk about my organization's contribution to health and safety of plant protection product users. It's a little bit a longer title, but we see how far we can go. Next slide, please. On this slide, you see a little bit a tractor or a little bit symbolizing farmers, people who are insured within my organization in the middle of the picture, and what could happen with chemicals, with plant production product and others. And to explain a little bit more, I just read 2 days ago that in Germany, sales of crop protection products in 2019 fell to around about 27,000 tons. And this is the lowest level since, or lowest level in 25 years. So to show a little bit the dimension and also the direction. So there are a lot of chemicals in the environment, but a little bit of hope. We have a continuous reduction. And another thing you might have in mind is that the farm to fork strategy targets at a 50% reduction in pesticides use and risk to 2030. Next slide, please. So what does the AIM member SVLFG, a little bit difficult to pronounce really, have to do with the endocrine disrupting, although it's the other way around, it's EDCs. So we are an accident and health and long-term care and old age insurance dedicated to farmers. And our mission, one of our missions is preventing occupational accidents and diseases. And chemicals can be found in plant protection products, no doubt about this. And to make it short, PPP are applied by people who are insured by SVLFG. And SVLFG is not responsible, has no legal responsibility for the approval or use of PPP. This is all done and regulated in the regulation mentioned on this slide. And there's a positive list of active substances permitted. Next slide, please. What does SVLFG do to protect people working in agriculture? So we are focusing on advice and information, and I would like to shortly present one of our main principles. That's the STOP principle. So this abbreviation stands for substitution and for technical, organizational and personal protective measures. And there's some sort of hierarchy between these three principles. And the next slide, please. You see what this means a little bit illustrated on this slide. We would like to start, and it's most important, with the substitution. Wherever it's possible, we advise our insured people not to use chemicals, plant production products, but to use other tools and other measures, for example, physical ones or technical ones. And if this is not possible, we advise to take technical protective measures. And you see on this a little bit smaller picture what this could be. It's just one example. And third level would be organizational protective measures. And only on the fourth level, we have personal protective measures. For example, gloves and shoes and other protective, personal protective means. On the next slide, and it's already the last one, we are again, or I would like again to focus on information. And we think that with the information we give since a lot of years, we are contributing to a reduction of the use of these products. And so we are contributing to the European policy of really reducing these products and saving health and safety for not only our insured persons, but for everyone if possible. So that's the end for now.
Thank you very much. That was excellent. And I think what I really took away was, your advice is that you're starting out with substitution and avoiding use of chemicals as a first criteria, and then down the chain. And I really think it's important that that you have these information, advice out there, and that is contributing, hopefully, to a better, less a reduction and no use of pesticides or plant protection products. So thank you very much. We don't have time for questions, I'm afraid, or any further questions to the panel, because we need to move on to our last kind of, I think, finale of this webinar. But I first of all want to thank all three of you for giving us these excellent examples. We'll make your PowerPoints, and if you have any other materials that you would like to share with our viewers, be sure to put them in your PowerPoints or links. I think that will be really, really useful. So thank you very much, all three of you. It's excellent to have these examples. And now I would like to invite SVLFG to turn on her video. And she is the Executive Director of AIM. I was saying AIM before, but I noticed it's AIM. And I'm really excited to be able to finish this webinar with a call to action that you are actually launching today on this webinar and sharing with us. So I will give you the floor, and great to have you here.
Thank you very much, Jen, and also for the moderation of this short but dense seminar. I'm going to share my screen. Everybody sees the presentation?
Yes, it's
Okay, good.
not in presentation mode, but I think that's...
Yeah, that's what I try to do now. Yeah,
okay.
Okay. Okay, so actually, my role is to just finish the seminar, and I'm glad that some of our members presented some concrete examples of what they are doing to limit people's exposure to EDCs. So, and our members are also the ones who inspired us to take action back in 2017, and at that time we published our first declaration on the topic. As you have seen also with Natasha's presentation, since then action has been taken both at international and European level, and also the WHO presentation, and especially lately in the EU in the wider context of the Green Deal and the chemical strategy. And we're actually pleased to see that things are moving in the right direction. So it is to keep the momentum alive and to join our voice to the debate that we decided to update our declaration, and it will certainly feed into the works of both WHO and the EU. But first of all, I would like to start by thanking HEAL, and more precisely Jen and Natasha, because without their valuable and expert input, we would not have been able to put together the document which I'm presenting to you today. So let us dig into the content of the declaration. Our paper makes 8 concrete recommendations, which I will briefly present to you. So the first recommendation concerns actually the identification of the EDCs. We think that a proper identification is the first step towards regulation. There are currently important gaps when it comes to that identification in widely used consumer products such as toys, cosmetics, or food contact materials. And to close those gaps, we encourage to apply 3 categories of suspected, presumed, and known for the identification of EDCs. They reflect the available levels of scientific knowledge and evidence. We also highlight that the identification of an EDC under one regulation should have regulatory consequences in all legislation that addresses the use of and exposure to that substance. That will allow to protect consumers for all sources of exposure. I come to the second recommendation, and that is actually a strict approach to risk management. EDCs can have an impact at a very low doses of exposure. We therefore believe that once EDCs are clearly identified, chemicals categorized as known and suspected EDCs should be banned from all consumer products. As already mentioned, that ban should be applied across sectors and legislation. I come to the third. Apply the precautionary principle, and we already have heard that also from Christian. So as already mentioned, EDCs can have an impact at even low doses. AIM believes that no risk should be taken when it comes to public health. Therefore, we call for the application of the precautionary principle before allowing chemicals to enter the market. A substance suspected to be an endocrine disruptor should thus at least be restricted in consumer use. And the fourth recommendation is to empower consumers. An EU barometer on chemical safety from 2016 showed that consumers are not aware of the potential dangers of chemicals in general. As we have heard from Christian, the survey carried out by the Mutualités Libres found that 48% of the interviewees had never heard of endocrine disruptors, and up to 60% did not know about their impact on health. AIM believes that informing citizens on their exposure and its impact on health is necessary to empower them to limit that exposure whenever it is possible. And it's not only an individual responsibility, but also a responsibility for all those who are actually involved. They should be provided not only with information on the risks and impact of EDCs, but also recommendations or guidelines on how to minimize their exposure to those chemicals. And as you have seen, some of our members are already fulfilling that tasks. So the fourth one is empowered consumers. And the fifth one is safe workplaces. Some professions like farming, cleaning, factory work, and the healthcare industry expose daily workers to harmful chemicals, including EDCs. And you have seen that also in the presentation of Erich. That exposure should be minimized through a ban on the use of known EDCs at the workplace and a substitution with safer substances. Achieving safe workplaces is a responsibility of employers, member states, but also the EU. The EU indeed has the responsibility to protect workers from exposure to hazardous chemicals and to ensure a high level of protection of human health and the environment. And I come to the sixth recommendation. General practitioners, nurses, and midwives, to cite but a few, are in a perfect position to raise awareness and educate their patients on how to limit their exposure to EDCs. Their opinion is often trusted, valued by individuals. Yet, if healthcare professionals are to be involved in raising awareness about EDCs for prevention purposes, they should be provided with the necessary knowledge and tools to do so. Therefore, including EDCs in the medical curriculum and in further training of healthcare professionals is a necessary step. I come to the seventh one. And this is the industry and agriculture playing their part. Industry is responsible for its products and their potential consequences. The European Commission underlines in its chemical strategy the needed transition to chemicals that are safe and sustainable by design. And Dr. Nera underlined actually in her speech that we really should strive for a more sustainable world after this pandemic. So that transition can only happen if industry is made accountable for its products. And regarding agriculture, eating fruit or vegetables can mean ingesting on average residues from 20 different endocrine disrupting pesticides. Therefore, reducing the use and the dependence on chemical pesticides can have a considerable impact on citizens' exposure to EDCs. AIM calls on the European Commission to devise political and economic incentives towards the safe substitution of chemicals of concern. Then our eighth and last recommendation is about thorough research. And we have heard that also several times today. There are currently an estimated 140,000 different substances on the market, and only 1% has been tested for endocrine disrupting properties. there is a need for ambitious targets to increase the number of chemical substances investigated each year, and in particular with regard to the endocrine disrupting properties. AIM therefore calls on the EU to invest in research to identify endocrine disruptors and assess their risks by making endocrine disruptors a priority research topic in European research programs. So these are, in a nutshell, the recommendations included in our declaration. I invite you to visit our website for more information. As you have seen, we all need to play our part. WHO, HEAL, and AIM and its members have shown you today that they are ready and will continue to play theirs, while continuing to call on decision makers to play theirs too. I thank once more all the speakers for their excellent interventions. I thank the Mutualités Libres, Christian Horemans in particular, HEAL, Jenan, Yvonne, and Natasha for co-organizing this event. And thank you very much also to Jessica for her great work. And of course, all of you for taking part to our discussions today. I wish you an excellent afternoon.
Thank you very much, Sibyl. Excellent presentation and also an excellent conclusion to this webinar. I think this call to action will be so important for our work going forward and all the work that the mutuals and your members have done. And I just want to close this meeting, this webinar, more or less on time. You will soon be getting a recording and you will also have access to the slides that were shared today via our websites. And I want to thank all of the participants who've been with us today. We had over 100 people who registered, and just a big thanks to our members, the mutuals, for making this happen. So thank you very much, and wishing everybody a great day.